So, COVID, yeah, it's still here. We are seeing a drop in the COVID level, as is typical this time of year. However, it's really delayed. Also, it is not dropping everywhere. I mean, first of all, still really high levels for this point in time. Actually, if you look at the overall national average at the top of the circulating COVID in the wastewater, it's as high as it was in the pre-winter fall spike. So that's not really great news right there. And then down on the regional chart, it's actually going up in the Midwest. So both the Northeast, the orange line, and the Midwest, the purple line, are very high. They're in like 600 and up. And the Midwest is actually going up. I think it's about 800 right now. That's extremely high. And the worst part is we're in mid-March. You can see it on the top chart that by now the COVID levels usually have come down. But if we switch to the year-over-year view, that's a close-up, and the 2024-2025 line, which starts in March just because that was where it started being tracked in 2020 originally, you can see that for this time of year, it's way higher than it was in any other year. And actually the last 2 years are a lot higher this time of year than they were in the first 3 years. So is the pandemic in that sense getting worse? We may be seeing fewer deaths that are being attributed to COVID, but last year it was the number 3 leading cause of death, and the number 1 and 2 causes, heart disease and cancer, it directly contributes to. I mean, directly or indirectly, depending on how you're measuring that. But I mean, as far as the heart disease, it's directly contributing to damage to the heart and the circulatory system, blood vessels. It causes clotting and things. So, I mean, it's definitely doing damage to the heart and circulatory system. And then as far as the cancer, it also depletes your immune system, really causing a havoc with the T cells, which is one of the main pillars of your immune system, which helps to fight off cancer. So, yeah, I mean, it's definitely strongly in the running, let alone the long COVID, the disability, which I have had long COVID. I still feel at times more or less affected by it. I feel like it's definitely better for me than it was in 2021. Many people aren't so lucky. But yeah, starting off 2024 with a very high, unseasonably high level of COVID. Where it goes from here, we don't know. But basically, the governments have stopped really trying to deal with it at all. So let's follow up on this because actually earlier this month, the CDC dropped their recommendations for isolating from COVID. There we go. CNN Health, CDC drops 5-day isolation guidance for COVID-19, moving away from a key strategy to quell infections. So this was 2.5 weeks ago on March 1st. And can you really call it the Centers for Disease Control and Prevention when they are telling people who have COVID that they do not need to isolate at all, which again was a key strategy for reducing the spread. So reading the article, this is just a snapshot from it. People who test positive for COVID-19 no longer need to routinely stay away from others for at least 5 days, according to new guidelines from the US CDC issued Friday. The change ends a strategy from earlier in the pandemic, the ongoing pandemic, that experts have said was important to controlling the spread of the infection. The agency says that it's updating its recommendations for COVID-19 to bring them in line with its advice for other kinds of respiratory infections, including influenza and RSV. So much for not conflating COVID with the flu, because literally the CDC is now declaring you should treat COVID like the flu. You absolutely shouldn't. But this is the CDC, and they're the loudest voice by far, on the public health landscape. And you got an entire public health system at the state level too, and an entire medical system down to many individual practitioners and healthcare workers who are just complicit in this. But while the main transmission route is the respiratory system for COVID, that's how people catch it, it is not a respiratory illness. I mean, it can infect any kind of tissue that has ACE2 receptors, which does include the lungs, but it can hit many other organs almost as hard as it can hit your lungs, like the heart, liver, pancreas, kidneys, brain, and so on. It can cause, the list of long COVID symptoms is extremely long, and it can include seizures, brain fog, cognitive impairment, all kinds of really serious things. We've seen in children, it increases the odds because of the pancreas damage of developing both type 1 and type 2 diabetes. Heart attacks, strokes, blood clots deep vein thrombosis. It goes on and on and on. All kinds of gastrointestinal problems. So it really wreaks havoc in the body, and now they're just saying, oh yeah, you treat it like the flu. Literally, you don't have to isolate, nothing. Offering a single set of unified guidance will make people more likely to follow it, agency experts said. So that's complete capitulation to public resistance and laziness. That's really all that is. It's just capitulation to, the public whined about it, so we're just going to start promoting bad science. We're going to just present things that are against everything that medicine knows about SARS coronavirus 2. Just because, people were complaining. And, we don't want people to complain, so we'll just tell them it's like the flu. That'll be fine. That's literally what the CDC is doing now. Namely, the CDC says that people who have COVID-19 should stay home until they've been fever-free without medication for at least 24 hours, and their symptoms have been improving for 24 hours. After that, it's fine to resume regular activities, agency experts say. So that is upping people's risk of long COVID right there. If you don't do lots of rest for some time after that, you are upping your odds of developing long COVID by prolonging the infection and the damage that it's doing in the body. But they recommend that people take additional precautions for the next 5 days, including improving ventilation, masking, and limiting close contact with others to lower the risk of spreading it. But if you're downplaying it this much, is anyone going to take that seriously if it inconveniences them? No, of course not. You need much firmer recommendations because it's if people are going to end up only doing half of what you suggest, if your recommendations are below the minimum of what actually needs to be done, then they're going to wind up doing half of that. This is just common sense. Anyway, these enhanced precautions are particularly important for people who are around vulnerable individuals, such as those who are elderly or have immune function that's been blunted by medication or an illness like cancer. And so they debuted a detailed section on, quote, respiratory virus guidance on its website Wednesday. So this is now the phase of the pandemic that we are in. So have a few more articles here worth mentioning. This is from the New Republic. COVID taught us a lot. The CDC now wants us to forget it. The agency reportedly plans to tell people, this was before March 1st, so I guess they got an early tip that this was going to happen on February 28th. The agency reportedly plans to tell people with COVID and other infections to isolate based on symptoms. Researchers, though, say that symptoms aren't a good indicator of who's contagious. So we'll read a little bit of this. It's a pretty long article, so I won't be able to get to the whole thing. But 4 years after the COVID-19 pandemic slammed into the United States, forcing shutdowns and killing 1.1 million people and counting, I think we're definitely at 1.2 million people. I'm not sure where they got that number from. The U.S. is considering one of the final steps that might cement COVID's status as just another virus, similar to the flu or RSV or HIV, I guess, because both can knock out your immune system, at least in part. Instead of recommending a period of isolation for those who test positive for COVID, the U.S. Centers for Disease Control and Prevention, or U.S. Centers for Disease, as I like to call them, because I don't see the control and prevention so much, plan to recommend a symptom-based system, which is what we just read in the other thing, being fever-free for 24 hours and etc. This could be part of broader, quote, pan-respiratory guidance, a topic that CDC Director Mandy Cohen reportedly broached last fall. This is a travesty. I don't know what else to call it. While public appetite for COVID news is low, experts say, and why is that? Because the public's appetite is shaped by the messaging that tells people it's not important. So, self-fulfilling prophecy there. Experts say that the stakes for communicating about respiratory illnesses are deceptively high. An ongoing bird flu outbreak and a small but deadly swine flu outbreak in Colombia this year have public health experts worried that another flu pandemic is all but assured in coming years. As government officials downplayed COVID, flu, and other deadly viruses in recent years, shortening COVID isolation times and lifting restrictions, including at the behest of airplane company CEOs, misinformation about measles, another respiratory illness, or again, let's stop just calling it respiratory illness because it can be transmitted that way, but people just think it's something that makes you cough. That's not what it's about. Has proliferated. A massive measles outbreak is currently roiling Europe, and Florida has now reported multiple cases at a single school, which we covered before. The public health system in Florida is just kind of letting that rip. State officials who rose to prominence by opposing COVID measures said that the 200 unvaccinated students who had been exposed didn't need to quarantine. So anyway, I can't go into the rest of this article for time reasons, but I would recommend checking that out if you are interested. So, left to their own devices, what is the public going to do? Well, here's some insight into that from a study from CIDRAP, the Center for Infectious Disease Research and Policy, I think, at the University of Minnesota. So this is from end of January 2024, a month and a half ago. 3/4 of adults have hidden infectious illness to work, travel, or socialize, surveys suggest. So 3 out of 4 people will just hide in order to, just do what they feel like doing. Up to 75% of adults have concealed an infectious disease from others in order not to miss work, travel, or social events, according to a new study in Psychological Science. The article, by researchers at the University of Michigan, is based on 4 studies and surveys given to 4,110 survey participants. And by the way, that is, as long as they, drew from different demographics, that is representative of the U.S. In statistics, the U.S. may have a very high population of like 330 some million, but you don't actually need that many. You only need a little over 3,000 or so to get an accurate representation, statistically speaking. So over 4,000 is actually very good and representative. All surveys were given after March 2020, when the COVID-19, they wrote COVID-10 pandemic began. And I'm like, COVID-10? What's that? It's like a new thing to be on the lookout for. And initial survey participants included 399 university healthcare employees. Only 5% of participants across all studies said that they had concealed a COVID-19 infection. Okay, well, I guess that's a little bit better, that only 1 in 20 specifically concealed COVID. Great, I guess, but still 3 out of 4 were concealing something else in order to just do what they want. 85% of students concealed illness. And of course, there is pressure on people to just go to work anyway, but don't conceal it. Tell the boss, hey, I'm sick, I can't work. If they make you work, they make you work, but at least don't conceal it. And obviously mask and do whatever else. This is also why we need, paid sick leave, and we need to keep placing demands on the system. That needs to march forward, not go into retreat, which is exactly where the Biden administration is leading it by saying, oh, you don't need to rally for COVID protections. COVID's, it's just it's like the flu or RSV. Anyway, in the first study, the researchers surveyed 399 university healthcare employees and 505 students and asked how often they actively covered up symptoms of infectious diseases from others, came to campus or work without telling others that they were feeling ill, or they falsified answers to mandatory symptom screening tools that the university had required for anyone using campus facilities. 85% of students reported concealing a contagious illness, as well as 61% of healthcare workers. So going to the doctor, prepare to get sick. Only 8% of healthcare workers and 3% of students said that they concealed illness due to a university policy requirement. Instead, almost all efforts at hiding were made because of not wanting to miss social engagements, school, or work. Quote, thematic qualitative coding. Coding in qualitative research is where you go through the statements and you try to find trends that you then code with a particular marker, revealed that participants frequently concealed illness because their illness would conflict with other social goals, such as going on a date. Very infrequently, they cited pressure from institutional policies, like lack of paid time off, as a motivation for concealment, the authors wrote. So as I said, paid time off, it's important because then you can knock out some percentage of people doing that due to the missing work. But actually, according to this research, most people were doing it for optional social activities. Transmissibility and symptom severity matter. The second study was conducted on August 1st, 2023, and it asked 946 participants how and when they would consider hiding an infectious illness, but not COVID-19. Participants said that they would consider concealment when the illness was described as being moderately transmissible and as having mild symptoms. But again, this is in 2023. As we get into late 2024 and 2025, and that's the messaging that people hear about COVID, that you don't have to worry about it, would the odds of doing that with COVID go up? I think it stands to reason that they could. A third study of 603 participants showed that illness duration, whether long or short, was not a strong factor in concealment. The fourth study included surveying both healthy and sick participants. The authors found that healthy participants reported being more likely to conceal when the potential harm of their imagined illness was low than when it was high, as did currently sick participants. Quote, currently sick participants reported concealing more than participants who merely imagined being sick, the authors said. The authors said that their findings revealed an insensitivity among most participants. Quote, healthy people forecasted that they would be unlikely to hide harmful illnesses, those that spread easily and have severe symptoms. But actively sick people reported high levels of concealment, regardless of how harmful their illness was to others, said Wilson and Merrill, a doctoral candidate and lead author of the study, in a press release for the Association for Psychological Science, which publishes the journal. So in other words, when people are healthy, they're more likely to say, oh yeah, I would totally not conceal it. I would be, honest about being sick. But then when push came to shove, when people actually were sick, the reality is that they would actually hide it. They were more likely to hide it. So anyway, a little bit of social science there. This kind of comes into another general trend that we've seen in this pandemic. This is from Lee on Blue Sky. Most articles where the author complains about COVID safety boil down to, I love thinking of myself as a compassionate person, and the constant reminders that I am selfish are stressful. This is very true. So it's actually modifying the behavior, actually doing something that might inconvenience you for the sake of not harming someone else, is something a lot of people really seem to struggle with. But if you actually want to think of yourself as compassionate, concerned about public health, not ableist, not helping a disabling virus to spread. This is what we were saying before about, quote, leftists who are not masking and not trying to consider how capitalism has been the main reason in downplaying the harms of the pandemic. You like thinking of yourself that way. You like thinking of yourself as being on the left or compassionate or whatever, but it may not actually align with the reality. Now let's talk about vaccines for a minute. We talk about masking. That is important. There's been so much controversy and so much politicization about vaccines in general in the United States, both masks and vaccines. But in the United States, the vaccines in particular, which vaccines are always kind of like a fascist rallying cry of being anti-vax. But this is a study. COVID vaccination markedly reduced blood clots, heart attacks, heart failure, stroke, and other adverse cardiovascular outcomes, as seen from over 20 million people, about half of whom were vaccinated. And you can see a chart on the screen where your odds of getting these negative health outcomes like blood clots, heart attacks, heart failure, stroke, and other things related to cardiovascular harm, vaccination is going to reduce your odds of all of that. So this anti-vaxxer talking point, which we've covered in the past about myocarditis, is myocarditis a risk from the vaccines? Yes, because it contains the spike protein, or it contains instructions for your body to make the spike protein. Yes, there is some risk of that. There's some risk of taking any kind of medicine. So there is a risk of that because you're letting the spike protein loose in your body, and some people will get a little bit damaged by that in the process of training your immune system. However, as we've seen in other studies before, the odds of getting myocarditis, the heart muscle damage, from an infection is much, much greater than getting it from the vaccine. So you get the vaccine to prime your immune system to fight off the infection more rapidly. Yes, there is some risk of myocarditis from that, particularly in certain populations. It's not equal across all demographics. But your risk from an infection is so much greater. And it has been demonstrated yet again in this population study with 20 million people, half of whom were vaccinated, half of whom were not, roughly, that yes, getting vaccinated is going to reduce your odds of all of those serious things. I mean, do you want blood clots? Do you want strokes? Do you want a heart attack? Do you want heart failure? I don't. I'd like to reduce my odds of that. And as we've seen from the BioBot wastewater charts, which measures the amount of circulating virus, this thing is still circulating. So whether or not you end up in the ER or whatever, you can still end up with serious heart damage and maybe clotting issues later on. So yeah. So not only do the vaccines work, but they, in terms of reducing your odds of experiencing these outcomes, what about being vaccinated too much? Well, here's something published in The Lancet, Infectious Diseases. The title of the study, or correspondence here, adaptive immune responses are larger and functionally preserved in a hypervaccinated individual. This is from March 4, 2024. So essentially what this article is a case study on a 62-year-old male, hypervaccinated individual, as they describe him, from Magdeburg, Germany, who deliberately and for private reasons received 217 vaccinations against SARS coronavirus 2 within a period of just over 2 years, 29 months. And this occurred outside of a clinical study context, so he was not studied, getting all of these. But what they found was he was basically fine. This guy got over 200 COVID vaccines. I mean, there's no reason to do that, really. But he did, because somebody was going to do it. What's their summary? In summary, our case report shows that SARS coronavirus 2 hypervaccination did not lead to adverse events and increased the quantity of spike-specific antibodies and T cells without having a strong positive or negative effect on the intrinsic quality of adaptive immune responses. While we found no signs of SARS coronavirus 2 breakthrough infections in him, that's their name for them, for this person to date, it cannot be clarified whether this is causally related to the hypervaccination regimen. So they didn't find that he had any breakthrough infections, but some people who aren't hypervaccinated don't get breakthroughs also. Importantly, we do not endorse hypervaccination as a strategy to enhance adaptive immunity, because they found that the adaptive immunity was not improved, but the spike-specific antibodies and T cells were. So there you go. Apparently, at least some people can get over 200 COVID vaccines in a 29-month period and be basically fine. I mean, whether this person had, significant enhanced benefits from that doesn't appear to be the case. Some slightly enhanced benefits, but yeah. As far as the vaccine hype, this guy got literally over 200. You have so much more to fear from an infection, which just causes rampant spike production in your body, as well as other harm. I mean, the spike itself is harmful and inflammatory, but there's other harm from an infection as well. Anyway, speaking of harm and speaking about getting rest with COVID, let's talk about exercise in COVID for a second. This is, again, from CNN Health. Take caution resuming your fitness routine after COVID, and then they're lumping them all in together, RSV or influenza, experts say. I'm not going to get super into this article, but it's what I was saying before. You have to rest if you get infected. If you just run with it, and as soon as you feel slightly better and your fever goes down, you go back to normal levels of activity, including exercise, you are upping your risk of causing a complication. Do not do it. You need to take time. If you want to look at those recommendations, look up that article. But again, that is the basic principle here. People need to take rest a lot more seriously. Kind of finally, as far as the articles go, I wanted to highlight some work from the Canadian COVID Society. So the Canadian COVID Society launches to address long-term effects and prevent further illness. This is an article from the Canadian Press, and good for them, I guess. So a national nonprofit group called the Canadian COVID Society launched on Wednesday with co-founders saying that the organization is needed as public health agencies have pulled back on COVID-19 prevention measures and awareness campaigns. Quote, I feel in some ways we are filling a gap where public health has dropped the ball, where they're filling a gap that public health has left open. Dr. Joe Vipond, one of the Society's 5 co-founders, said at a news conference. In his home province of Alberta, quote, there's basically no mention of COVID. There's no mention of long COVID. It's really fallen off the radar for a lot of public health at this point, said Vipond, who is an emergency physician in Calgary. Quote, while the acute phase of the pandemic has ended, I would be curious of like how you're characterizing the acute phase as far as like people just dropping dead en masse. That I think that's, a potentially really misleading statement, as we saw is currently circulating in the U.S. higher than ever for this time of year. Anyway, the virus continues to cause significant chronic illness, the Canadian COVID Society's website says. COVID-19 was the third leading cause of death across Canada in 2022, behind heart disease and cancer, it says. Quote, it still continues to be a stressor on our health system. Up to this present day, it is contributing to poor health and excess deaths, said Dr. Kashif Pirzada, another co-founder of the society. So the article goes on. And this actually kind of reminds me of something, like when in the U.S. we have the People's CDC, which doesn't really get enough press. I've linked to them on the channel. If you go into the Home tab or click the About, I forget even where to find that. I think it's if you scroll down to the bottom of the Home tab on youtube.com/socialism for all, or at socialism for all. I linked to the People's CDC, but I think they only have like a couple thousand subscribers. I don't think that they're really getting that much attention. It falls to other people. As somebody who is somewhat educated on these topics, I want to do more where I see that there is a need. I had somebody kind of raging in the comments about this, actually. They're like, you're just filling in for, like, you're doing the work of like an NGO. You have to tie it into imperialism. I'm like, well, first of all, if harm is being done by this thing and I know something about that and I have something to say about that, I'm going to say something about it. And they were just getting really mad that I was, doing work that the government should be doing. Okay, but they're not doing it. So it still needs to be done. Yes, I'm going to do it. And yes, it is tied in with capitalism. We've discussed that like a million times. But I think I just posted something related to COVID on the community tab. And I got this like, I think you're mad at the wrong people there. I get this a lot, but anyway. I get that when we're talking about really angering social issues, sometimes that anger bleeds over, but try to keep that in check. Anyway, I wanted to, in closing out this week's COVID segment, hype a couple of lists here. So this is at COVID Aware. If you go to Linktree, linktr.ee/covid.aware, AWARE. You can find this link tree where they have a number of resources to, and there's the People's CDC on Substack. You can see a bunch of resource lists related to staying up to date on COVID and why you should stay up to date on COVID. And then this is another one that I have shared in the community tabs and I think mentioned in streams before. This is Linktree, linktr.ee/capitalism and disability. It's actually created by a listener who I am in touch with, and they're doing great work. This is a super long set of options. You want to tie COVID into capitalism and imperialism? Here you go. There's your list. Linktr.ee. There's no real easy way to say it. Linktr.ee. There's like no good way to say that. /capitalism and disability. and you'll find this great guide connecting, ableism, capitalism, disability, and COVID. So there you go.